with this, I invite the next speaker, Dr. Bhumija Bhatt. She will be speaking on intravitreal chemotherapy for vitreous seeds in retinoblastomas, experience from Eastern India.
A very good afternoon to all. I am Bhumija Bhatt. I'm a fellow in oculoplasty at LV Prasad Eye Institute, Bhubaneswar campus. And I would like to present our experience of intravitreal chemotherapy for vitreous seedings in retinoblastoma and experience from Eastern India. So as we know, the targeted therapy in retinoblastoma is widely accepted as the current management tool with the aim of increasing the drug availability at the location of the tumor. Its effect is multiple folds higher compared to the systemic delivery of the chemotherapeutic agents that we use. The direct delivery of the chemotherapeutic agents into the vitreous cavity definitely helps to overcome the challenges and the accepted worldwide. So coming to the materials and methods of my study, it's a retrospective analysis of retinoblastoma patient who received intravitreal melphalan and raw topotecan for vitreous seeds. And the data compasses of the time period, the data that has been collected from 2017 to 2024. And the medical records have been evaluated for the demographic profile of the patient, which includes the age at presentation and also the gender of the patient, the laterality and the grouping according to the ICRB classification at presentation, the morphology of the vitreous seeds, intravitreal chemotherapeutic agents used, the total number of injections given per eye, and definitely the response to the therapy. The primary disease was treated with a minimum of 6 cycles of 3 weekly intravenous standard triple drug therapy that was given to the patient. And additionally, the focal laser thermotherapy and cryotherapy were also administered as and when indicated for the patient. The patient who had at least 3 months of follow-up from the last intravitreal injections were included in our study. So the primary outcomes of our study were the seed regression and the recurrence of the vitreous seeds post intravitreal chemotherapy. The secondary outcomes guiding the study are the globe salvage rate and the ocular complications post-therapy. The age analysis showed that the mean age of presentation was 17.7 months, a range of 2 to 36 months. The mean follow-up was 23.5 months. Total 19 eyes were included in the study, which received 51 injections in all, with a mean of 2.7 injections given per eye. Coming to the vitreous seeds morphology, 14 eyes showed dust, 13 showed spear, and 5 showed clouds. Coming to the result of the study, the seed regression was seen in 16 out of 19 eyes, that was 84.2%, and time to seed regression was a mean of 1.2 months, a range of 0.6 to 3.2 months, while seed recurrence was seen in 3 eyes. The globe salvage was attained in 63.2% of the eyes. The complication of the intravitreal therapy noted were cataract that was seen in 3 out of 19 eyes and pigmentary retinopathy that was documented in 2 eyes. I would like to summarize that the intravitreal chemotherapy with the melphalan or topotecan resulted in complete resolution in 84% of the treated eyes over a mean follow-up of 2 years. The globe salvage was 63%, with the complication rate being reasonably low. I would like to focus on that the more than half of the enucleated globe had recurrent tumor but regressed vitreous seeds. So I can conclude that the globe salvage may be impacted even after a good vitreous seed control has been attained. Thank you so much for your patient listening.
So you have the combination melphalan topotecan or only single drugs were used?
At a time, at one sitting we give single drug, but then we definitely, if we start with topotecan, we increase the dose or we switch to melphalan when the patient is not responding.
And in all those cases, is it it's a adjuvant therapy or it was you have already primary systemic chemotherapy or intravitreal chemotherapy?
Definitely, a primary systemic chemotherapy is given, but only when there are focal diffuse seeds which require treatment and they are recalcitrant to the systemic therapy, we go for the intravitreal therapy.
And what about the frequency after each interval? How many, after 2 weeks, 3 weeks, how do you?
3 weeks, 3 weeks.
Okay.
Thank you.